For accurate, dispassionate communication, messages should be clear, short, and focused on the issue at hand, not on the sender or receiver. But the clearest, most accurate and most succinct message will forever languish in the ether without the emotions necessary for the receiver to take it into their mind. There is a balance to strike here though. Much of the subtlety we put into communication for emotional reasons does not translate well into other cultures or languages and is liable to lead to confusion. When speaking to someone with a limited grasp of English, softening a blow by saying, "I would rather not," instead of "I will not," is liable to lead to misunderstanding. So what about message length? On average, only 5 pieces of information can be kept in a person's short-term memory. The receiver can be overloaded by more than this, or, as we all know from email, if too many messages are sent at the same time. If numerous points or messages are necessary, then you can help the receiver with a written copy of the message and by making a priority of the different points clear. Messages come in 2 basic types: mechanistic and transformational. Mechanistic messages are those like a machine. They are simple facts that can be passed from one person to another in a stream, like dates of birth, blood pressures and drug doses. There is no requirement for a person handling the message to understand its meaning. For example, the message, "Tell Dr. Jones urgently that the serum potassium is 9.5 millimolar," can be given to a non-clinician who can deliver it accurately without understanding its significance, which happens to be imminent cardiac arrest. Transformational messages send understanding of systems or emotional feelings to the receiver. They are so called because they change or transform both the receiver and the sender's mental models. Mechanistic versus transformational classifies messages according to what they contain. Structured versus narrative classifies them according to how they are arranged. Structured messages use a formula to present related pieces of information in a pre-agreed order. Their purpose is to avoid missing out important points. In medicine, we have a pre-agreed structure for communicating case histories: name, age, sex, presentation, history of presenting complaint, etc. Another one is the way we write research papers. The introduction says why the research is important, then materials and methods, results, and a discussion that is often subdivided into putting the research into the context of other results, limitations and implications. And finally, we have a conclusion. There are situations where a message structure is not agreed between the sender and the receiver beforehand, but it can still be used to help remember essential items. This is true in situations where we frequently communicate the same type of information. An anaesthetist who is specifying requirements to an assistant before induction frequently has the same list to communicate. Giving some thought to how best to structure the information, for example airway type, induction agent, muscle relaxant, and then using the same structure each time can aid clarity and reduce the likelihood of omissions. Look at these 2 pictures. Both refer to the equipment necessary for intubation. The structured version makes it much easier to spot what's missing. Structured communication is good for mechanistic messages, but it's poor for transformational messages. In narrative or storytelling messages, the items communicated all either state or support a common theme or premise. Purely structured communication ignores these associations between items and imposes a list-like structure to ensure that nothing is missed out. Of the 2 forms, narrative communication is much easier to understand and remember and is the best method for transformational communication. The narrative approach does not have rigid rules, but commonly starts with the most important facts to communicate and then fills in the background and supporting information. Good narrative takes careful thought, and this mental habit is worth forming. When you have a message to send that suits narrative, preview what you plan to say before saying it and ask, what is the main point? Could it be shortened? Could it be clarified? Are there things that do not add to the message that I could omit? Are there things that do add to the message that I could include? Have I got the main point first and supporting information second? Is the message organised for maximum clarity? There have been various attempts to combine narrative and structured messages. The best known method is SBAR for Situation, Background, Assessment, Recommendation. Other structured forms of communication include 5-step advocacy. This system specifies using names to get the attention of the receiver and seeking feedback. Many teams have developed versions of these and other tools suited to their needs. Such aids do not help with true narrative communication, which is improved by knowledge, experience and intelligence, which are not under our control, at least not in the short term. What anyone can do, however, is think before sending. Structured communication is common in fields like aviation, where the same essential components of information must be transmitted time and again. In healthcare, the method has the disadvantage of being inflexible. While it prevents missing out essential things, it gives little guidance on how to organise complex messages for the easiest comprehension. Most healthcare communication is not highly stereotyped, and therefore a narrative approach rather than a structured approach allows concepts to be communicated more clearly. Let's look at the same basic message expressed in the different ways.
Hello, is that the on-call anaesthetist? Vascular registrar here. I'm phoning about a 76-year-old man. He's complaining of pain in the back, radiating into the right groin. It came on fairly abruptly about 3 hours ago and has progressively worsened since. He does have previous medical history of exertional angina, which is controlled on nitrates and is stable. He can climb 1 flight of stairs before stopping. He lives with his wife, who's fit and well. He smokes 20 cigarettes a day and is a social drinker. On examination, he has a cold sweat. Pulse is 100, blood pressure 105/55, and there is a tender possible pulsatile mass in the abdomen. Vital signs are improving with resuscitation. A CT shows a ruptured abdominal aortic aneurysm below the renal arteries with aneurysmal dilation extending into the left common iliac artery. We're planning urgent transperitoneal repair. Hi, it's the on-call registrar. We've admitted a 76-year-old man with a ruptured aortic aneurysm. CT shows it to be below the renal arteries, but there is aneurysmal dilation of the left common iliac. He's a smoker with a history of stable angina, but is otherwise reasonably well. He was in hypovolemic shock on arrival, but is responding to resuscitation. I've spoken to the anaesthetist, Dr. Gass, on the phone number 4243.
The structured version may be appropriate for facts written down on a page, where the reader can skip from place to place, but the narrative version is far more suited to the serial nature of speech. Good narrative communication differs from structured communication in 2 important respects. First, the speaker organises the points they wish to communicate into a hierarchy of importance. They then present the essential features first with supporting information afterwards. Second, the speaker prioritises information to present according to what the listener is likely to be interested in, rather in what they personally feel to be important. They change the presented information depending on who they are talking to. The anaesthetist was particularly interested in the patient's exercise tolerance and smoking habit, and less so in the detailed anatomy of the aneurysm. The consultant surgeon was interested in whether the patient was fit for anaesthesia, but less so in his exercise tolerance, and showed more interest in the technical aspects of the aneurysm and its repair. Also, the consultant will want to ring the anaesthetist, so the anaesthetist number is helpful. Narrative has the disadvantage compared with structured communication that it is easier to miss important items. It's clearly better than rigid structured communication for most healthcare settings, but it cannot entirely replace it. Narrative communication works by association. Our issue was an aortic aneurysm. In order to form a narrative, the sender must know the importance of an aneurysm and how it is related to the clinical condition, the necessary treatment, and what the priorities are from the point of view of the various people they are speaking to. This knowledge of association takes training and experience to acquire. For these reasons, narrative communication is at its best when used by senior members of a team. less experienced, more junior members may not have the knowledge necessary to use narrative communication effectively, and they're more likely to miss out important things. Junior members of the team depend more heavily on structured communication and senior members on narrative. At each point in a team member's professional development, they have to strike a balance between structured and narrative communication, depending on their level of experience and knowledge at the time. The best advice before speaking, therefore, is to consider both structured and narrative strategies and to develop the best narrative possible while using structured tools to help remember issues to mention. There is one further limitation of narrative communication. It requires transformational communication on the part of the sender. The sender must have a mental model in order to form the narrative. If Peter explains a situation to Jane in narrative communication and Jane then explains it to Tom, Jane cannot simply repeat Peter's words. In order to communicate effectively, Jane must have understood what Peter said and then form her own narrative. If Jane does not fully understand what Peter said, this narrative will be inaccurate or incomplete. Structured communication can be passed from person to person with much less reliance on each individual's understanding. In the next video, we turn to channels of communication.